Hello, I'm Patricia Pellica from the Mayo Clinic, Rochester, Minnesota. With me here today is Dr. Bill Zogby, Director of the Cardiovascular Imaging Center at DeBakey Heart Center in Houston, Texas. Bill has conducted a very important study assessing the role of contrast in patients undergoing dobutamine stress echocardiography. Bill, tell me about your study.
Well, Patty, what we did is we studied more than 100 patients with dobutamine echocardiography, mostly to look at the impact of contrast on the accuracy of dobutamine stress testing in the diagnosis of coronary artery disease. The way we designed the study was to have an individual undergo two stress testings, one without contrast and the other one with contrast, to look at the accuracy compared to conventional dobutamine stress testing without contrast. And the results were very interesting, is that the impact of contrast in improving accuracy was certainly significant, particularly in individuals where the confidence of interpretation coming from poor visualization of the endocardium was low.
So you found that the contrast administration improved the confidence of interpretation of the study and also the accuracy compared to coronary angiography as the gold standard.
Correct. What we wanted to do, obviously, there were other studies looking at contrast improving visualization, but the question still remained whether does it improve accuracy. And indeed it did, particularly in individuals where you could not see two or more segments of the myocardium, therefore close to 15% of the heart that was not well visualized. In those patients, the improvement in concordance with angiography was about 30%. In individuals where all the segments were nicely seen at baseline and during stress, there was no, obviously, improvement in accuracy. But the ones in between, where you have one or two segments that were not seen, the impact of contrast was more modest, was about 8% or so. But certainly in the ones that you could not see the endocardium well, the impact was tremendous.
That's a very important study. It's previously been shown, of course, that contrast increases the confidence in interpretation, but it's really required this type of study with angiography and with the patient undergoing two stress echocardiograms to demonstrate that it actually impacts the accuracy of interpretation of the study.
Correct. And this was the challenge of individuals undergoing two stress testing within 24 hours, but I think they were very nice to do that and showed really the importance of good visualization of the endocardium. If it is without contrast, that's fine, but if you don't have good visualization of the endocardium, this is necessary to have accurate results with dobutamine stress testing. And I would probably extrapolate to other modes of stress testing that visualization needs to be there for almost every myocardial segment for us to be able to infer accuracy from stress testing.
The American Society of Echocardiography recommends that contrast be used with stress echo if two or more segments cannot be visualized. Do you agree with those recommendations?
The recommendations I think we agree with, because here in our study the cutoff was at two or more. So I think we're very close as to what the recommendations are. But most importantly, I think we have to see the vast majority of all these segments to be able to infer a good accuracy from this stress testing. So I think if the confidence is not there at the resting image of the walls are not well seen with echocardiography, I think contrast should be used for accuracy.
Has the black box warning from the FDA impacted your practice with stress echo and contrast?
In general, it has impacted our practice of echocardiography in general, but not for stress testing, because as you recall, the black box warning are mostly for unstable patients, be it unstable coronary artery disease or heart failure, in addition to other scenarios. But individuals who undergo stress testing are by definition stable. So from that contraindication point of view, really it doesn't apply in the vast majority of patients undergoing stress testing. And the other requirement at this stage, which is monitoring for 30 minutes, is inherent in stress testing. You start monitoring when the patient starts undergoing the stress test, and usually you monitor for a period afterwards. So it really has not changed our practice really from contrast or optimizing stress testing with imaging.
So to summarize, in this new study in about 100 patients, undergoing dobutamine stress echocardiography, contrast was shown to improve the diagnostic accuracy of the test in that population with technically difficult images by increasing the accuracy of image segment visualization and interpretation of technically difficult images. Congratulations on your fine study, Bill.
Thank you, Patty.